Welcome back to Mobility Project. A couple questions that came up on the blog that I want to talk about. One is this continued business about elbow pain. When we don't have a name for something, we call it itis. An itis is an acute inflammatory response lasting somewhere between 3 and 13 days. And when you overdo it, like you say you take the chuck it in your ball and you're throwing the ball a million times and you just blow out your elbow, that's an itis. If it's hot, you need to treat it like ice. I almost said ibuprofen, suckered you, ice, fish oil, rest. I want to show you a couple things. When we have a flaming hot issue here, usually from my thinking, is it's rarely about just the insufficiency of the tissues here, but it certainly can be about the pulling of those kind of insertions of these musculature on these elbows, on these condyles. But when I see most of the time, when I see a hot elbow, it always goes with this lack of shoulder positioning. Now take a look at this. We work on this internal rotation all the time. We're a big fan of internal rotation. This internal rotation of the shoulder doesn't necessarily mean that I'm going to internally rotate in these positions, but I need to have the slack because when I bring the shoulder into this, I need that position in the capsule so that I can keep the shoulder back in a good position where I can then actually rotate into a strong supported joint position. What often happens is as I throw or as I back squat, as I do a lot of pull-ups, if my shoulder isn't able, I don't have the capacity to keep my shoulder in a more neutral, on the shelf, wound up, close packed position in the back of the joint, then what often happens is that elbow comes forward and I expose this tissue to a significant valgus strain. And a valgus strain is just this kind of strain, this kind of internal strain. This is what we call varus, this is valgus. Valgus here, varus on the outside. Usually this just means the elbow's coming in. So when we see this, we've got to do a couple things. One, we've got to treat the elbow right off the bat. So the way I'm going to propose to you is don't be a knucklehead. Let's say that you have a paleo margarita. It's like the San Francisco margarita, but instead of actually having tequila in it, you've got your daughter's banana. But what I want you to do is make it simple about this. Grab a piece of ice out of your gin and tonic. I think gin is paleo, right? Wrap it in an ice cube. Don't get a cryo cup. Don't get a Dixie cup. And now look, I'm icing and then I'm drinking and icing. So I need to create blood flow on those tissues. So hit that thing, 5 minutes of direct ice massage. I've got it wrapped, wipe the water off. You can get it actually colder, wipe the water off. Keep wiping the water off and then very quickly, this is going to be very, very numb. 5 minutes of ice massage equals 20 minutes, 30 minutes, 40 minutes of some crappy bag of peas. Ice cube, hit the issue that's pissed, come back in. Over your body. If you're having pain in a joint or in a tissue and you're not icing, you don't have a problem. That's that simple. Simple. If you have a pain or a problem in a joint that's causing you issue and you're not icing, you're lying. You don't have a problem. So start dealing with it. 5 minutes of ice massage is very powerful. Creates a bunch of blood flow, a whole host of things. Okay. The other thing we're going to think of is, hey, if I can't get my shoulder back in a good position, I'm exposing myself to a valgus force here that can smoke me. We know that the thoracic positioning, being able to be supple through the thoracic spine, allows this to happen. Today on the main site, you've got a ton of knees to elbows, you've got L-sits, you've got burpees. It's going to require lots of extra rotation, otherwise it's going to be overextended and the shoulder potentially is exposed to a lot of this valgus force over and over again. This is a roller that came from Rad Roller. These guys sent us one. There's 2 lacrosse balls, and they figured out a way to anchor them together in a much sexier way than the 2 taped together balls. And I think you get them at Rad Roller, but you can see that they're analogs, and the difference is that you're not, I mean, this one's junky and ugly now with the dog hair, but it also has my skin attached to it, and this one is cool. Rad Roller. So you need to hit the thoracic spine for a couple of reasons. One is to improve that thoracic positioning, but also remember that if this is a neurodynamic problem, how the elbow is going through the nerves going through the elbow, if I'm not supple through the upper back, then I'm not giving slack from the nervous system, feeding it forward to the elbows. Remember that if I did a live ultrasound on this wrist and flick the wrist back and forth, you can actually see the nerves tuck from the other side. This is the truth. And so your nervous system is a container, or your nervous system is a finite length within this container. So I need to make sure that the container is supple so that I don't screw the nervous system down and then end up with a pull of that nervous system right around the elbow. Okay, so either way we treat it. In fact, check this out. This is a wooden spoon, and the Chinese have a concept called gua sha. And gua sha is taking a Chinese soup spoon or some kind of wooden spoon and actually raking the surface around an injured tissue, trying to create blood flow again. Especially relevant if I have tendinosis, which is kind of a junky tendon sheath problem, which is what normally problems that are going on for 2 or 3, 4, and 5 months. So here's homework today. Gua sha. I probably butchered the name of that. I'm sorry. Take a look at this. I want you to test yourself on your pull-up position versus your chin-up position. Remember our original mandate, this needs to equal this. What you're going to find, dollars to donuts, is that this palm-facing position, this supinated position, is going to challenge this position. And especially as you get overhead, you're going to find that if you're short, that shoulder's going to come forward. And so what you're going to see is this is a good, strong tell about me being in a bad position. Most of us are very competent about pulling here. As soon as we are asked to pull in this position, many of us can barely hold a grip. You'll see the twisting and torquing happening, and that's because I lack this capacity to be externally rotated. We keep seeing this overhead external rotation, pressing external rotation, pulling external rotation. I've got to be able to generate this external rotation. That external rotation happens to protect. All right, so take a look. Here's a new mode for you guys. When you are doing the swimmer stretch, do not pull your arm across your chest. That is an impingement test. It's an analog for seeing how impinged I am. What I mean to do is drive the shoulder to the back of the socket, like we did with the thoracic spine yesterday. So I'm going to lay here. I'm going to hook my arm into this thing. If this makes you feel vulnerable, sketchy, don't do it. But look, I'm going to get some lateral distraction. Remember, the shoulder is just a little hip. This looks like the hip mode we do. The band is pushing me laterally. I'm going to hook my hand, which moves me into external rotation. Hey, there it is. And then I'm going to take this hand and push it through to the back of the shoulder. And I'm going to drive the direction of forces through the shoulder. I can pull the shoulder tight. What's happening is I'm going to push down into the back. I'm not going to get that impingement. And I'm going to mobilize here, back and forth. I'm just pushing straight through the femur or through the humerus into the back of the shoulder. I should feel a little stretch there. And while simultaneously I'm getting kind of this distraction. So take a look at this. I'm just going to do this for 2 or 3 minutes. I've done it for 20 seconds. And let's test, retest, and tell me if you don't see a better shoulder position here. Absolutely. I'm in a stronger setup. I'm exposing this arm to much less valgus torque here because I've just spent my second opening up just like the hip. I want you to go do the test on this. See how many chins you have, then flip it over and see if you can double that in pull-ups. Or you can do the opposite. I want to spend some time on this thing, hit that thoracic spine, ice your problem, and then let's give you one for the hip. Take a look. We're going to start here, just normal flexion. I can hit this piece in the back. Adrian likes to lift his leg off the ground, squeeze his butt, press down. This should be a familiar position to you. Let's go hunting through the back hip here and try to really bias some of this lateral tissue in the hip, in the chest. And then we're going to shift it back into this hip, kind of screwing back and forth, and then let the foot fall out. Keep twisting up, try to get the belly button to the foot. We're going to keep winding across until I kind of hit the back. Spend 2 minutes on that. Go PR tomorrow. We'll talk to you then.